I will give now the floor to the second presentation from Athens. It is a great honor to have Lieutenant Maria-Christina Giannakopoulou to present another set of presentations from the Hellenic National Defense General Staff Medical Directorate. Maritina, the floor is yours, and thank you for your contribution.
Thank you very much. Good morning to all of you from Athens. My presentation is going to be brief, and the issues that we are going to propose, in the context of our cooperation in research, focuses mainly on the section of epidemiology and infections. Our first suggestions concern hospital infections. As you know, hospital infection refers to any infection that occurs in a hospitalized patient and was not present even at the incubation stage when the patient was admitted to the hospital. Epidemiologically, we know that hospital infections are blamed for about 5 to 10% of patient hospitalizations, with adverse effects on a large percentage for them, as well as for the increase in hospitalization costs, mainly due to the need to use of high cost of medication. The surveillance of hospital infections providing reliable data, while in addition it offers the possibility of detection of epidemics by educating and sensitizing health professionals. So, in the main of compare and contrast between our hospitals, we have a research incidence of bacteremias from multi-drug resistant pathogens, microbial resistance rates of the most important nosocomial microorganisms, as well consumption of antimicrobial agents. The next two suggestions are about the managing of the pandemic caused by COVID-19 and specifically the implementation of preventive measures against COVID-19. It will be a good idea for our research to see what measures were implemented in our hospitals, what were the results, and what were the possible changes in the implementation of the measures. And the last but not least, what about COVID-19 among hospital personnel? It would be good to see how the recording of cases and contacts between staff is applied, and which surveillance protocols were implemented to prevent outbreaks in the increased risk departments for our personnel, for example, ICU and COVID-19 clinics. The basic intention is that this exchange of information between us will help us to evolve, learn, and become better. Thank you very much for your attention.
Thank you very much, Maritina. Very brief and concise, and to the point your presentation. We have some very specific proposals from Athens. Again, if somebody wants to ask any question, I will make some general statements at the end when everybody had an opportunity to present his or her idea on the research. But if somebody wants to ask Lieutenant Giannakopoulou now, he or she may do so. Okay, thank you, Maritina, for your time and your presentation.